treatment, effective treatment. But you find out that the minimum of what is required is what is done to be able to max profit by the hospital. The same way the HMOs too is also trying to, you know, max profit. So the effectiveness of this treatment is questionable. So we need to do a lot in that area. We need to do a lot in that area because the effectiveness is quite questionable. It's
quite questionable. You've talked about HMO. I'd really, for the benefit of those who are watching, what HMOs are and the regulation of HMOs and healthcare stakeholders who are supposed to regulate what they do, their practices, and are we at par with the regulation in such a way that the HMOs can really carry out the functions they're supposed to carry out?
Well, the HMOs, they have like a body, and you probably need to have made some requirements to be able to, you know, get that status to be recognized or function as an HMO. Now, the HMO is Health Maintenance Organization. Okay. They are the link between individual, some corporate bodies, and the hospitals, the health facilities. So primarily, you'll find out that these HMOs, some are able to carry out, you do your payment to them. That is, you remit your own part of the payment. That's your part of the percentage. Every month you do that payment. But they are not all as, so to say, in quotes, as sincere as they ought to be. Some are not able, in time when you now need the service from the health service provider, because that HMO has not done your remittance to your primary healthcare provider, that is the hospital. When you go there, they tell you stories that you may not be treated. However, some have credibility. Some fulfill all they've signed with you to do, to ensure that you get your treatment at the primary center which you've chosen. But some don't. So we've had issues with, you know, the client now not being able to get treated at the time it's needed and having to seek other sources of healthcare treatment, and then they now, one way or the other, you know.
And the whole purpose is generally defeated.
Yes. So it's just a matter of proper regulation and the body itself ensuring or enforcing that the HMO that may have collected funds should ensure it is properly remitted and that adequate funds are remitted for proper treatment. However, I'm also aware of various cadres, that is classification of treatment. We have those who have the gold card, we have those who have the platinum card, and this actually gives you privilege to access various kinds of healthcare at various levels. There are some that are, I think, are able to access health. Probably they can fly them out based on the kind of contributions they make.
Yeah.
So depending on what you're actually contributing.
Now, this is the second time you're talking about cards. I'll refer again to Dr. Nablele, immediate past NMA president. This, I quote from what he had to say. He said, as it has made it possible for the formal sector to enroll without compulsion, it should fathom a way for the informal sector, the market woman, artisans to access it without compulsion too. If we begin to make it mandatory, because I mean there's been a question of some professionals or well, observers are saying what we're having a challenge is that it has a may and not a shall in the act. So it's not mandatory. And they're saying here, if we begin to make it mandatory, it means Nigerians who should constitutionally not be denied health care will be turned down because they do not have a health insurance card. How do you relate with that statement? Because, I mean, we're talking about, you know, we talked about formal sector, and we're talking about the informal sector.
Yes.
Quite a lot of the informal sector do not access healthcare. They pay by themselves. Like you said, 70% of Nigerians are paying for their own healthcare. How do you relate with this statement?
You see, presently, the scheme is most being implemented in the formal sector. That's why the coverage, as we said, is just like about 9–10%.
5% actually, that's what I have.
You see, so less than 10%. So majority of Nigerians are yet to key into it. We believe in the long run that if we try to make it a bit mandatory, what the market woman is paying, what the artisan is paying, what the bus conductor is paying may not be at par with what the banker pays, but it should be able to, because what you pay is a percentage of your earning. That is how it works. A percentage of what you earn is what you pay. So somewhere along the line, they will also benefit. But it's for us to be able to ensure that they are properly enlightened and they know that once I key into this scheme, eventually I will benefit. Most of the market women do contributions.
They do. What they call
ajo.
Good.
They do contributions. So it is, and when it comes to your turn, you collect. So it's the same way if you're making contributions towards your health. The day you're ill, like the scheme provides for, the person that's the individual, the spouse, and 4 kids under 18 years are eligible to benefit from it. So if they are able to get proper enlightenment about it, and the government carries Nigerians along, that's part of the challenges. People are not being carried. People just say NHIS and they probably don't even know what exactly it's doing.
It is.
So we need to do more in terms of publicity.
Good, because that's one of the challenges, awareness.
Yes, it's a major awareness.
That the awareness is not really at par what it should be, and so people don't even know what.
People don't know. Yes.
So you're at variance with what Dr. Nobulela is saying, because he's saying they shouldn't make it mandatory.
Well, in the long run, it's going to be of benefit to Nigerians.
So it should be mandatory?
Yeah, it should be mandatory.
Okay.
It should be mandatory.
Okay, well, let's go back. You said something about, well, I'd get to
recently, we had the Health Week, the NMA AGM, the annual general meeting last week, and the theme was mandatory health insurance, a vital key to achieving universal health coverage for all Nigerians.
Oh, okay. So there are some.
You see, what he's saying there is that
because he was actually talking about the fact that if you're making it mandatory, that every Nigerian should have his or her fundamental human rights should be respected, and that adequate provision of health care at affordable cost is a fundamental human right. So if you're saying mandatory, some may not have cards, and so you're denying them of that fundamental human right.
No, the fact that it's mandatory doesn't mean some won't have the cards. That's where I was trying to explain to you. The fact that it's mandatory is, okay, you're working, and then you're earning a particular amount of money. A percentage of that is what you're contributing. It makes it easy for you. A percentage of that is what you're contributing.
He feels that the government should take care of that.
You see, what's there is we need to be somehow also responsible for our own healthcare.
Yeah, but 70% of Nigerians are paying for their healthcare.
Yes, and sometimes when the emergency arises, the fund may not be available. But if you are into this kind of scheme, when there's an emergency, acute appendicitis doesn't tell you. Ruptured typhoid ileitis doesn't tell you. And these are very fatal conditions, life-threatening conditions. So if someone has such an acute condition, you should be able to present to the hospital and attended to, just showing a card. And what you're paying is meager compared to what benefits await you. So in the long run is what you stand to benefit. Because these funds are pulled together. We all can't fall in at the same time. So that is the whole idea.
Yeah, that's the whole idea. Well, as at March, in a trade fair in Enugu, the Executive Secretary of the National Health Insurance Scheme, Dr. Femi Thomas, he said no fewer than 7.2 million Nigerians have enrolled into the various health schemes of the agency. 7.2 million, Olusegun, 7.2 million. 7.2.
Out of 160 million. That's exactly, that's what we're saying.
And that's quite, I don't even know how to begin to describe that. How can we, because there's also the problem of this awareness, especially for the people in the informal sector. They don't even seem to have an idea of the NHIS, or in fact, there was an argument. The federal government was asking the state governments, to join them, to either to register with them. The state governments were saying, no, we will handle it at our levels, and that was how, of course, they started. But the state governments are now doing that, it's another question. And whether the former, even some of the former companies, whether they're doing that too, is another question altogether. How do we begin to try to get above? Because I'm going to give statistics here, and the statistics is quite, do you say, discouraging for a country that prides itself as the giant of Africa. When countries like Rwanda, Ghana, I mean, I'm going to get to that, but it's quite discouraging, really. It's quite discouraging. All right. Like I said before, it looks like those in employment, only those in employment, and it depends on the company anyway, are enjoying this scheme. What more, assuming that the NHIS, they are listening, what more can we do to get those on contract? In fact, this brings me to an issue. Recently, a company, okay, maybe I should not call the name of the company, I think they sacked their staff. Maybe you heard, quite a great number. Some of them were complaining how they were being called monkeys and all that. And then some said that they have, things like health insurance or whatever, but that it stops at them. Their family is not involved.
Okay.
How do we be? That's an anomaly.
Yes.
And some of these companies are not even, there are companies that have come to invest in Nigeria. What is our government doing to stop such things? Because that's apparently unlawful.
Yes, as it is, probably that particular company has its own kind of scheme. Because if it were related to the NHIS, the policy has its guidelines and its requirements, and the enrollees are clear. So they can't just stop it at the individual. Maybe it's a sort of intra-company, that's a local thing within the organization, that they do some health deductions for that individual, and then when he's ill, I'm sure a person must have signed a policy. This is what we are saying, that we need to take it a lot further. Good.
Just hold that thought. I'll get back to you now. Abdul from Sokoto, good morning and thank you for joining us on TVC Breakfast Show.
Good morning.
Good morning.
Good morning, sir.
Good morning.
I really appreciate this very important discussion you're doing, and I have a little contribution to make on it.
Okay.
And I also saying good morning to the gentleman sitting over there.
Good morning.
But one thing I want to say is, you see, a country that the majority of the people are not health-wise insured, then definitely the development of that country is critically shaky. Because a healthy nation is a developed nation. You see, like Nigeria, where you see majority of the people are working for the state. When you look at the number of people that work for Nigeria, you see majority work with the state, not federal. And as I talk to you now, from where I'm calling from the state, we have no such thing for the past government. I don't know of if this government has.
Hello. Okay, it looks like we've lost. Well, continue with your thoughts, and maybe you could talk on, if you did get him, maybe you could talk a little on about, but you were leading up to something.
Okay, well, he was talking about the fact that there's nothing on ground where he is in Sokoto State, and that the government needs to do more. It still comes to the area of awareness we were talking about. One, we need to do a lot of publicity and awareness concerning NHIS or health insurance generally. It is very vital. And then we need to create less bureaucratic procedures to ensure that people can be enlisted. Those are factors that needs to be considered. And the political will to execute it, to implement it, must be there. So once all these are factored into it, I'm sure the projects, the program should go places.
Should go places, all right. Attainment of health coverage by 2020. Is that feasible? That's what they're saying. We are now at 5%. And NHIS is saying our vision is to attain health coverage by 2025 years from now. Is that feasible? We're very tall order.
Well, some people believe